On behalf of the National Collaborating Center for Indigenous Health, I want to warmly welcome each of you to today's webinar, Alzheimer's Disease and Related Dementias in Indigenous Populations. We are very, very happy that Sarah Mcnabb and Jordan Lewis are here with us today to present on World Alzheimer's Awareness Day. My name is Roberta Stout, and I work with the National Collaborating Center for Indigenous Health. Our center is located at the University of Northern British Columbia in Prince George, the traditional territory of the Claytonay First Nation. I am, however, zooming in from Winnipeg in the beautiful Treaty 1 territory and the homeland of the Métis. I will be facilitating today's webinar. Very briefly, the NCCIH is one of 6 national collaborating centers for public health that was established in 2005 with funding from the Public Health Agency of Canada. Our sister NCCs are focused on specific topic areas, including infectious diseases, environmental health, healthy public policy, determinants of health, and methods and tools for knowledge translation. Our center supports health equity for First Nations, Inuit and Métis peoples by promoting the use of Indigenous-informed evidence to transform practice, policy, and program decision-making across all sectors of health. We encourage all of you to submit questions as you listen to presentations through the Q&A tab, as we will have time for discussion following the presentations. Links to resources mentioned by the presenters will be posted in the chat window. Today's session is also being recorded and will be available on the NCCIH website. Closed captioning through the live transcript button at the bottom of your screen is available. There may also be some slight pauses as we switch between speakers. In terms of the learning objectives, today we are going to learn more about understanding the current context and risk factors for Alzheimer's disease and related dementias within Indigenous populations. We're going to explore the development of engagement and education resources for Indigenous peoples related to Alzheimer's disease and related dementias at the community, national, and international levels. As well, we're going to identify some innovative programming and research underway to support Indigenous peoples living with Alzheimer's disease and related dementias. We are delighted to have 2 speakers today on this webinar. I'll introduce our first speaker and have her speak, and then I will introduce our second speaker. So Sarah Mcnabb is the Dementia Project Coordinator for the Inuvialuit Regional Corporation. A beneficiary of the Inuvialuit Final Agreement, Ms. Mcnabb was born and raised in Inuvik and is proud to call it home. Sarah attended Aurora College in 2017 to pursue an education as a personal support worker. In 2019, she attended a program called the Dementia Ambassador Training, held by the Alberta Alzheimer's Society, and is now a certified dementia ambassador. In her position as the Dementia Project Coordinator, Sarah looks forward to connecting with the people of the communities and other organizations to engage and educate on dementia. Sarah, the floor is yours.
Thank you, Roberta. Hi, everybody. I'm Sarah Mcnabb. I will just start my presentation here. So this is a dementia project that is going on at the Inuvik Regional Corporation. It's raising awareness for our people. A little bit of background I will give is the IRC does annual corporate tours for each of our 6 communities within the Inuvialuit settlement region. During that time, A concern and question was voiced asking if IRC was doing any work to help beneficiaries better understand what dementia is, as there were more people getting diagnosed with this condition. Of those affected by dementia, they were having to be put up in long-term care facility and leaving the comfort of their homes and families. The people of our communities care a great deal for our elders as they are the knowledge holders of our history, and with them being far from home or having very little support and resources at home, the knowledge would have been lost. A consultant was hired to gather information on this very topic, which in turn helped us to develop a work plan to bring awareness and be a support for people living with dementia and their families. Our main focus in our project is to gather information of what our people know, what they need to know, and how to live with and care for a person living with dementia. In our history as an Inuit, it has been researched that there's many barriers and gaps in our knowledge about dementia, and many of our people need to know more. I have pulled an excerpt from the Indigenous Perspectives and Cultural Understanding. It is suggested that there's some evidence about age-related dementia have only recently become more common in Indigenous population. As our people tend to live longer, they've become more likely to experience dementia. From our surveys that what we know from our surveys that we have done, we found out that there is very much need for education around dementia, including the signs and symptoms, what dementia is, what to look for, and how to take care of and / live with somebody with dementia. Many of our Indigenous populations in the Inuit settlement region have little to no education on what dementia is, as back in the day, it was never an issue and people did not notice any changes in our people. Some did notice, but did not think of anything of it. The work that I've been doing so far, as many of you know, due to the pandemic, I have been working mostly on gathering information. I'm putting together work plans for the future, and started off with simple surveys for healthcare workers and few members of our surrounding communities, with hopes to build off our work plan of the information gathered. I have begun to search for a working group to help me develop materials to be used in an awareness campaign and begin to create resources specifically focused around dementia. For an example, information packages for them to take home and other resources in our communities. The main focus right now is to train workers, such as community health representatives, on the basic fundamentals of what dementia is, how to care for people living with dementia. After I meet with the CHRs in our region, I plan on working closely with them to host information sessions with community members and work on establishing educational resources in take-home packages. In the future, my plan is to hold community engagement sessions where I can work directly with people living with dementia or caretakers. Right now, due to COVID, I cannot take that step yet. I will work on revamping the supportive pathways training to allow it to be more culturally appropriate to train our home support workers, personal support workers, and hospital staff who may work with people living with dementia. I will work on culturally appropriate sensory items for the long-term care in Nunavik and surrounding communities, such as memory blankets using traditional items. We will also be looking at a working group of key Inuit settlement region members to work to translate keywords about dementia into specific language utilized in a specific community. Thank you, Koyaneni, Sarah.
Thank you so much, Sarah. We really appreciate the work that you're doing. And if anybody has questions for Sarah, again, put them in the Q&A tab at the bottom of your screen. I will now be introducing Dr. Jordan P. Lewis. So Dr. Jordan P. Lewis is Inuit from the native village of Mcnabb. He is the Associate Director of the Memory Keepers Medical Discovery Team and a professor at the University of Minnesota's Medical School. His expertise is in Indigenous successful aging, rural community health, generativity and healthy aging, cultural constructions of Alzheimer's disease and related dementias. His research has identified Indigenous cultural generativity as a critical ingredient to healthy aging, which has important implications for the well-being of Alaska Native and American Indians, including dementia caregivers and family and community members. I'd like to please welcome Dr. Lewis.
Thank you, Roberta, for that introduction. Pull up my presentation. All right, well, I want to thank the organizers for the invitation for us to present at this conference. It's an honor to share about our work. And so the topic of this presentation is focusing primarily on American Indian communities here in the United States, but also discussing some of the work our executive director, Dr. Kristen Jacqueline, and her team have done. So first off, to acknowledge our executive director, Dr. Kristen Jacqueline, who's really spearheaded a lot of this work that is now the foundation of the center we're at. Dr. Melissa Blind, who's our senior research associate, who's done some great work in this area as well with Dr. Jacqueline and provided some of the content for this presentation. We'd also like to reach out to and acknowledge our community partners, our Elder Advisory Board, our caregivers, the family members, and the elders who've all contributed to our work. So to start off with, this is what our research center looks like. We are located in downtown Duluth, Minnesota. It was designed 5 years ago. This kind of gives you an inside picture of what our center looks like. We've recently renovated the basement or the first floor, adding about 20 more offices, and our research team continues to grow each month, which is very exciting. So a brief outline of this presentation, I'll be starting off by giving a brief overview of the context and risk factors of Alzheimer's and related dementias for American Indians. I'll go briefly over some of the resources the research team has developed that are available to everybody. Then I'll transition and talk a little bit about the work I'm doing around dementia caregiver research that can be applied to other populations. So as most of us are aware, risk factors, health disparities are impacting Indigenous populations across the world. But some specific risk factors for dementia in Native communities include limited physical activity, so having a more sedentary lifestyle, lower socioeconomic status, experiencing hypertension, type 2 diabetes, obesity, smoking, and high cholesterol. And several of these are vascular related. Another major risk factor, which is not on here, is age, which is the primary risk factor for dementia. And so that's important to think about as well. As older adults and Indigenous populations are living longer, they're more likely to have the opportunity as they grow older to experience dementia. So in the current context, to give you a snapshot of what's occurring now, we know that by 2050, there's one new case of dementia expected to develop every 33 seconds. That gives us approximately 1 million new cases per year, and that's expected to continue to grow and range from 11 million to 16 million cases. As I briefly mentioned, the Indigenous population in America, American Indians and Alaska Natives, people over age 65 have nearly tripled since 1976. And so if you think about age being the #1 factor for dementia, with this tripling of the older adult population we're seeing, we're gonna see more cases of dementia. And as we're noticing in conversations with our healthcare providers in the Indian health system and our local communities, we're not prepared for this growth of dementia cases. And so with that, we really need to increase our understanding of what dementia means from a cultural perspective and integrate those views and understandings into our healthcare system and the education of our healthcare providers. So Indigenous understandings of dementia vary by every community, by every cultural group, every family in some instances. And so with that, it's almost impossible to really have a global perspective of what it looks like. And so further research is needed to explore what this means by cultural groups, by communities. And a lot of people ask why it's important to really kind of understand, why do we want to know what cultural groups or families know about dementia, or what are their beliefs about it? You can take that information and really educate our healthcare providers, integrate those cultural beliefs into treatment, into education, into support services. We also realizing that if we could educate family members that certain things about dementia are not a natural part of aging, that their values and their perspectives and beliefs on dementia are respected and honored when they go to the doctor, it may hopefully lead to an improvement in their process of care and support. In the state of Alaska and most other states, you're required to have a physician or a doctor give you an official diagnosis of dementia to even be eligible for various support services. And so having that diagnosis is critical to supporting the family caregivers. We also are finding that enabling Indigenous people to understand what's going on, that it's not a natural part of the aging process, that there are supports and services and programs. Hopefully we can see that they're going in to get earlier supports and treatment in the earlier stages of the disease. And we're learning also that through our work, this earlier understanding and incorporating these understandings of dementia into our education system, into our healthcare system, is leading to more culturally safe dementia frameworks, not only for the family caregivers, but the persons living with dementia. So as we think about this idea of cultural safety, Dr. Jacqueline and her team have written about this with regards to dementia and First Nations populations. Cultural safety fits along the continuum of cultural competency. It's not the same thing as cultural competency, but it's a stepping stone as you move forward. It's an approach that considers how social and historical contexts, such as historical trauma, bad experiences with the healthcare system, as well as the structural and interpersonal power imbalances that exist. For example, older adult and the physician, there's that built-in power imbalance in that relationship, as well as the experiences in the healthcare system. And so developing culturally safe models of dementia requires first that understanding of how do Indigenous people understand dementia? What does this mean? How do they integrate it in their personal beliefs, their interactions with the healthcare system and their community, as well as not only the individual's perspective, but the family and the community care preferences. Sarah did a great job talking about the community needs, having the community support, educating everybody. Community care preferences vary as well, and having that support by the community when there may be individuals that are assigned to dementia, having that support outside the home is critical. So shifting gears a little bit, we have a website. Dr. Kristen Jacqueline and her team have established this ICARE, which stands for Indigenous Cognition and Aging Awareness Research Exchange. There's a free listserv on there you can sign up for, has a wealth of resources. In her work over the past several years, they've been doing work around knowledge translation, moving research findings into practical tools for communities, healthcare providers, the Indigenous patients and their families. And so all these tools on here and the next few slides I go through are all available at this website. So they've developed Indigenous fact sheets. Here are a few examples here that are available to download off that iCare website. They were developed with support from a contribution agreement with Health Canada, First Nations and Inuit Health, Home and Community Care, 2014 to 2017. So this is examples of, based on their research, working with community partners, doing a comprehensive literature review, an environmental scan of health promotion materials. They worked with community partners to develop these resource guides and fact sheets. They have also worked on developing and culturally adapting the Cica. They have now the Canadian Indigenous Cognitive Assessment, which was an adaptation of the Indigenous Cognitive Assessment out of Australia. And so they are now it's validated, it's being used in several communities. And so that's a wonderful resource that family members can use, caregivers can use, providers. And so this has been several years in the work with many community partners to test it out and see how it works. And now we're at the stage where healthcare providers are using it. Few other resources available on their website here. The Cica, they have videos that go along with it to kind of explain how it's used, as well as the guidebook instructions, and then they have it in different languages as well. So shifting gears, I've moved to Duluth, Minnesota, March 2020, really developing my caregiver research. Currently, I have a project with the White Earth Nation. We're learning caregiver supports in Indian country are limited. There's a natural assumption, given the intergenerational component of our families, that there's built-in supports for older adults with dementia. But despite that cultural value that exists in our families, there's still a need for supports due to the caregiver burden and stress. And so through this process, we've established a caregiver advisory board. We're in the process of adapting the Savvy Caregiver in Indian Country manual, which is a training manual for caregivers that doesn't really need to have a class. You can really teach yourself as you go. And we're looking at modifying it to reflect the values and needs of the White Earth Nation, with the goal of enhancing their feelings of mastery also. When you feel more competent providing care for your loved one, it improves your quality of life as well. And so we feel that if we can incorporate more culture into that training, it'll bolster those feelings in other areas. Also in the process of developing a dementia caregiver peer mentoring intervention, or AIA and DANCE, Dementia Advocates for New Caregiver Education, built off the notion that we're culturally adapting the senior companion program, where older adults who are either retired or were previous caregivers are paired with the current caregiver to serve as a mentor. And so we're weaving together this idea of intergenerational relationships with Western caregiver education and training, and building upon those cultural beliefs, and providing a sense of purpose and feelings of generativity for the caregivers who've been through that journey and may wish to share their experiences to help others. So the key takeaways of our presentation, our research at our centers, really it's important for us to acknowledge that there's still gaps. We're making great progress in our research, but given the diverse populations we're working with, there's still gaps we need to address, and looking at how to best prevent, treat, and care for dementia. That we need to realize and understand that cultural understandings, cultural beliefs, and constructions of dementia need to be respected and considered in our approaches to care. Not doing that not only harms their experiences, their care, but also as a process of colonization. Thinking about this framework of cultural safety, it can be applied to our individual care efforts, but also at our community level. And we need to think about how we take these cultural safety frameworks to an organizational level. For example, getting our hospitals to start thinking from this framework and ensuring that everyone who comes through the door for care is culturally respected. And finally, it's important to partner with caregivers and our families and our communities, as Sarah has mentioned in her project, to culturally enhance training programs to improve caregiver mastery, as well as the outcomes of people with dementia and their families. These are a few of our partners. I want to thank you for your time.
Thank you so much, Jordan. And I'll have you stay with your video up as well. I'll invite Sarah to also rejoin us through video. So I want to thank both of you for those excellent presentations. I know that we have received several questions through the Q&A. that I'll ask each of you to think about and respond to. So have you seen or examined the pandemic's impact of social isolation as a risk factor for Indigenous populations? So I would invite either of you to speak to this, as I'm sure you're seeing how COVID has impacted our ability to socialize, and particularly how seniors and elders are finding themselves in more socially isolated situations. Sarah, did you want to comment first, and then I'll go over to Jordan?
Yeah, sure. So it has been a big struggle with COVID here in Inuvik and the surrounding communities. We don't have very much people living at home with dementia, like per se here in Inuvik, but the ones that are, like say in the long-term care, I'm unable to access, going to see them. So I'm working on that right now with hopes that COVID will allow me.
And Jordan, I'll have you jump in.
Sure, yeah. So in our communities here in Minnesota, we've definitely, they've experienced extreme isolation, I would say, not only because people can't visit, there's lack of socialization or community activities, but due to, I get called the digital divide, lack of accessible internet, cell phone service that exacerbates this idea that they can't even stay connected to family or even community members in the same community. There have been efforts for support groups for caregivers to go virtual, but then again, if you don't have reliable internet or cell service, you can't even join virtual support groups. On the other side of that, in our research and our community outreach, there's still a fear of having people come into your home. So even if the mandates have been lifted and some community members are engaged in activities, some of our older adults and caregivers are really reluctant to even have people come in because of the fear of they have compromised immune systems or their loved ones are older and frail. And so it's definitely impacted our communities a lot.
Thank you. Another question came in about the role of traditional healers in the diagnosis of dementia assessment and care at the local community levels. Are they involved? Do they participate in any of the culturally safe dementia care practices? I wonder if either of you could comment on the role of traditional healers in the work that you're doing. And I'll leave it up to Jordan, maybe to first comment on that.
Yeah, so in Minnesota, I haven't come across any conversations about traditional healing. In this area of work, I know in Alaska and Anchorage, South Central Foundation has a traditional healing clinic, and they've been part of our research in the past. And they're engaged in healthcare with individuals with dementia, but their role is more of a, whether it's therapy or it's aromatherapy or massage, or the other different modalities they offer. They really didn't have any specific training or thoughts on how they can improve or use their traditional healing specifically for dementia. It was more the individuals come in because they want either comfort or they feel it's a way to reduce the stress. So there have been further conversations with them about what would more specific dementia care look like within their traditional healing clinic. So that's the extent I know in that area.
Sarah, did you have any comments about that question?
Yeah, because dementia is, well, it's not new around here, but it's not very common. I mean, what people know about dementia. I haven't heard much about traditional healing per se in our communities, but we do have elder advocates. We do have elder committees that work closely with elders. We have Elder Day program workers. So Traditional healing, not so much, as it's, like I said in my presentation, there's not very much knowledge, education around dementia in our settlement regions. That's all I have to say for that.
Could I just ask a follow-up, Sarah? You mentioned something called the memory blankets. Could you explain what those are?
Yes. So I will be working closely with the occupational therapists here in Inuvik to create memory blankets or memory pillows using traditional materials such as sealskin, wool, just trying to trigger memories from what people had when they were growing up, just getting the feel of, say if they were sewers or they're beaters. We'll try and incorporate as much as we can into the memory blankets for them.
Thank you. That's beautiful. Jordan, I think this one is more directed towards you. It is. Will anybody be discussing Indigenous populations such as the Tsimane Indians who live a traditional hunter-gatherer agricultural lifestyle and have 70% slower brain atrophy than Western industrial populations? Can you comment on that question at all?
Not specifically to that question. There have been conversations in the Arctic around more traditional lifestyles and how in certain pockets of populations there's less brain atrophy than more Western or industrialized nations. The only conversations that come up around that are when people are trying to figure out if dementia is related to environmental toxins and whether subsistence foods are still safe. There have been conversations among family caregivers where they've stopped eating berries or moose or salmon because they read an EPA statement that says they're high in XYZ toxins. So they attribute that to brain atrophy or dementia. And so they're, scientists are trying to figure out, what's the give and take between, do you continue to eat subsistence foods that are really healthy for you, even if they have maybe small traces of toxins, or do you stop because you think it's related to your brain health? But I couldn't speak specifically to that tribe that was mentioned, but that's kind of what we're hearing in the Arctic.
Thank you. So another question came in. Do either of you have any information on how those who are in long-term care can provide culturally safe care within homes after those LWD are located? And I'm not sure what that means. Maybe I think that had a reference to your presentation, Jordan. But in any event, looking at culturally safe care within long-term care, if any of you can comment on that.
Sure, yeah. So I think LWD is living with dementia, maybe. So over the years, I've been working with care facilities in Alaska. We've developed a culturally safe care manual that can be adapted for any community. It's available for anyone who's interested. Gives a really good overview of some basic practices people can use in terms of culturally safe care, whether they have dementia or they just live in a care facility. That would be a resource I could share that you guys could put on the website in terms of what are some really basic traditional food recipes, basic phrases you could use, communication style, passing on protocols, and when the appropriate time to have those conversations are based on cultural practices. I know here in the United States, the Centers for Medicaid Medicare Services have a long-term care support services website that's specifically dedicated to American Indian, Alaska Native long-term care and culturally appropriate care, ranging from living wills to traditional foods and care facilities, and what are the regulations around those. They highlight some best practices in Indian country that are more grassroots. And so learning from what our rural communities are doing and trying to elevate that to a national level as best practices. That would be another great resource.
Sarah, did you have anything you would like to add to that?
Yeah, same with what Jordan was mentioning. Talking about in my presentation, I had the revamping of the supportive pathways, which is the supportive pathways course that you take when you take the personal care attendant. I'm looking to revamp that and make it more culturally appropriate. As to what, I'm not completely 100% sure yet, but I know that the program will be revamped. I'm also going to be working on working on home care packages, like not home care specifically, but packages that they could take home with what to expect or like that kind of stuff, just packages for more in the home. But the supportive pathways will definitely be revamped and made more culturally appropriate for our communities.
Excellent, thanks. Another question came in. Is there Métis specific data being collected and understood? And maybe this speaks to the larger question of where there is research or data that is not yet available, and why or how, why is it difficult, or what is the direction that we need to take research and data into to ensure we understand fully what Indigenous peoples are experiencing with these diseases?
I could take that question to our executive director, Dr. Jacqueline. She may know. And the only reason I state that is she had an article that came out in 2017 and had referenced briefly that they didn't have any Métis data yet related to dementia. So I don't know if she would be aware of someone who's in the process of collecting that type of data or if it exists, but I would be happy to pass that on to her.
Thank you. Sarah, are you aware of any data that's been collected for Métis people specifically on dementia?
I haven't heard anything specifically with Métis, not in my time here at the IRC. Okay.
At the end of the presentation, we will be sharing some resources that people can be accessing that look at First Nations, Inuit and Métis experiences with Alzheimer's and dementia. So that screen will be shared following the Q&A. Okay, another question came in. Can you speak about whether some people are being diagnosed at earlier ages than mainstream population, and how this impacts on the eligibility criteria for dementia programming? By the way, it's a great discussion and presentation.
So I can start with that question. I think in my experience in the facilities I've worked with in Alaska, younger people are being diagnosed with primarily reversible dementias. So whether it's alcohol related or medication related, in the mainstream research, younger onset dementia is much more tied to genetics. You only see people who are diagnosed at 35 or 40 with a more genetic type dementia. I haven't heard any Indigenous people in their 30s and 40s diagnosed that young. Doesn't mean it hasn't been happening. But the ones I've seen in younger people are definitely either reversible, like alcohol, or it's progressed so long that it won't be reversible, but it was due to something that wasn't genetic.
Sarah, did you want to add to that?
What I know in our regions is it's being mostly diagnosed in elders, so the ones that tend to live longer. Most of our elders get sent to Yellowknife, so we don't have much here in the long-term care, but we do have, what we're finding is elders who are aging.
Thanks. Do either of you know of any traditional medicines that have been used or studied to be useful for dementia care, or traditional medicine gathering that have been studied to be useful for dementia care? I'm seeing
I'm not
shaking
aware
of
of
the
any
head.
research, but yeah, I don't know if there's any research being done. I just know that providers in Alaska and here talk about, using your subsistence diet to help, but not that I'm aware of any research.
Yeah, that's what I was going to say, is the diet is what I would only know about.
Thank you. Can either of you comment on whether there are protocols? So what protocol is there for Indigenous speaking people to assess traditional speaking elders to ensure appropriate assessments? So Sarah, maybe I'll ask you that first. So for Inuit speaking, for Inuit elders, is there a way to ensure appropriate assessments are done?
Yeah, we do have translators in all dialects in our regions. So yeah, we do have the translators for them to either go into the hospital or into the homes.
And Jordan, did you want to comment on that one?
So how our research works is we try to find local translators in the communities we're working with, but in terms of assessments, I'm not aware of any. I know Dr. Jacqueline works with some in her research, so I would definitely ask her for any people she's used multiple times that are familiar with the assessments that know how to translate that for the work she's doing.
Sorry, I should mention that it's not, there's no assessments being done in based on that, like the tradition or the translation. There's no assessment for them.
Okay. So Sarah, this just came in for you. It's a comment. What a beautiful idea, the memory blanket. Love it. So I think that kind of use of memories is really important when working with people who are experiencing these diseases. I know that songs and photographs are also really important. So music and those kind of things, but really good work that you're doing related to the memory blanket.
Thank you.
How are communities supporting those who are suffering from dementia? Are communities coming together and helping as a community? So Sarah, can I start with you on that one?
Yeah, so before COVID, we kind of have to speak on COVID terms. We do have elders programs in our region. We do have people that, like home care workers, go into the homes, but limited now with COVID.
And Jordan, did you want to add to that?
Yeah, I would agree with Sarah's comments. Pre-COVID, very good informal supports of families, neighbors, relatives. Many of our rural communities may experience lack of formal support, so like home health. So we do see our communities coming together to support as much as they're able to. And so that, a lot of our elders and caregivers are able to do this, be a caregiver for as long as possible until their healthcare needs get too much. But even then, there are instances where they can pass away at home peacefully. So yeah.
Do either of you believe that communities are ready for the increased rate in Alzheimer's and dementia that we're expecting to see? As you said, Jordan, in your presentation, an upsurge in the illnesses.
I would hope so. Yes, I think there are some communities, I think there's some great communities doing grassroots efforts in terms of educating the entire community so they're aware of what's going on. A few of our communities in Alaska are using the dementia-friendly movement to educate the entire community on warning signs, behaviors. And I think that's a great way of them being kind of ahead of the game. So if the rates in their community go up, they kind of are aware of what to look out for, how to properly care for them. They have a care facility there that with time, I think we need to look at how do we train healthcare providers to work with persons with dementia. I think in the United States, anyway, that's a huge gap in our training is we don't have a lot of gerontologists, geriatricians, people trained to work with people with dementia. A lot of our care facilities lack memory wings or memory units, specifically for the more advanced stages. So I think in our rural areas, yes, I think we're going to see the communities come together and work on this. They're asking for more training and education. Larger communities, I think we have maybe not a long way to go, but a ways to go before I think we feel we can adequately support that population. We have some urban centers in Alaska where homeless people are people with dementia because there's nowhere for them to go. We don't have the care facilities. We don't have people trained to take care of those behaviors. And so it can be challenging, but I'm optimistic.
And Sarah, I would just ask one follow-up question about this to you. I know that you are doing the dementia, you're a dementia care coordinator within your region. Are there other program coordinators who are doing similar work across other northern regions in Canada that you're aware of?
In our region, I don't think so. I'm not aware of anywhere else in this side of Canada, but I know that things are moving along, so we'll be ready.
Okay, great. This came in for you, Jordan. What is your understanding about dementia after a stroke?
So my understanding is it depends on where the stroke occurs in the brain, what the outcomes will be. Many people can have a stroke and not have related dementias either right after or long-term. I think it would just vary on where the stroke happens, the extent of the damage to the brain. But definitely there is, being it's vascular, there's a relationship, but.
Okay, and another one actually came in for you. It's about the CICA assessment and who's primarily using that. Is it professionals, families, and or friends? And is its purpose to replace the MOCA?
Yeah, so the Cica, I believe, can be used by anybody. I would definitely only go to your healthcare provider for an official diagnosis. It can give community members an idea of questions to ask to gauge whether or not you should seek a diagnosis or go for more specialized care. The MOCA is the Montreal Cognitive Assessment. It's a similar assessment tool. I don't think it would replace it. I think that the Cica definitely has been adapted for Indigenous populations in Canada, so it'd be much more relevant to that population. But the MOCA can be used as well. Some physicians, I think, do different ones based on their preferences, what they're looking for, what they're noticing. And so that would be my assessment of that. I would go to the website also, the iCare website, and it will give you much more details, gives you examples through the videos of how they're used. But it's a great resource.
Sarah, any comments that you wanted to add to that one?
I will be looking into that.
Okay. All right. So we have a question here. Has there been any research done to determine the contribution of APOE4 to Alzheimer's disease in Native populations? So for those of us who are not aware of APOE4 means, I would appreciate knowing. So Dr. Lewis?
I'll try my best. So APOE is the the alleles in the brain that lead to plaques and tangles. So there's a specific genetic marker that makes people more predisposed to plaques and tangles, is how, and I could be completely wrong, but I think that's what it is. And so they're doing a lot of research to figure out, is the presence of the APOE4 allele leading to more likelihood that you'll be diagnosed with dementia down the road. I'm not aware of any research with that specific focus for Indigenous populations. I do know someone I could connect you with that has done work within that area, who's much more well-versed in that APOE work and genetics. Dr. Neil Henderson, who's recently retired from, he was at our research center for a few years. He's done a lot of that work in the early 80s and 90s and throughout his career, but he may be a wealth of information. The National Institutes of Health and the National Institute on Aging would be another great resource. They probably have done a lot more in-depth research in that area, but I can definitely help get connected to those resources.
Okay, and this is a question for both of you. Have you come across higher misdiagnosed cases in the healthcare system related to dementia in the Indigenous populations?
Mine is pretty simple. My answer, I haven't, no.
Yeah, I don't think so either. I think there's the misconception of, I think people jump to the conclusion it's something else besides dementia. And the work we've done, a lot of our healthcare providers, such as physicians, are weary of giving that diagnosis without doing a lot of extra work around it. For whatever reason that happens. So yeah, I would say no as well.
Great. I guess this is a request for advice. What ideas may you suggest for engaging with elders living with dementia from both a support worker perspective and a caregiver perspective? So any words of advice for that on that topic?
I guess one recommendation is to try to think about what stage of the disease they're at will kind of determine kind of the level of interaction and activity you would have. The other thought is there's great videos there's activities you can do. I think Sarah has some great examples like the memory pillow. There's things that you can do together as a family. I think it's important to remember that despite having a diagnosis of dementia, they can still be actively engaged in activities when it's safe, for as long as they're interested or able to. There's excellent videos online. Teepa Snow is one of the leading experts in dementia care and kind of working with caregivers and persons with dementia. There's some activity books out there. Alaska's done some great work around bringing people out on the land, picking berries, taking them to places that are meaningful for them. And so that would be one recommendation. And the other thing I always tell people, they're still able to do things they enjoy. So ask them what they enjoy doing if they're able. But yeah, based on their level of the disease or the stage they're at would dictate what you're able to do.
Those words were taken right out of my mouth. Yeah, for both home care and for being at home and at work, like working with elders in a long-term care facility. What I would suggest, or not suggest, but advice is just have a lot of patience with your loved one or somebody that you're taking care of. Take them out on the land, of course, socialize. Basically just what Jordan said.
Are there any technological tools, technology that we can be using to work with elders?
What you mentioned before with the music, I know there's in the Avon Manor in Yellowknife, they have like the recreational coordinator there at the Avon Manor does music in memory, and I've watched them, and I'm just it's incredible how much they it brings them back to who they are when their dementia is so severe.
Mm-hmm.
So just taking them back in when they were young, or what they remember, bringing them back to what they used to do, hobbies, stuff like that.
Jordan, did you have anything to add on technology?
Yeah, I'm glad Sarah mentioned the music and memory, because that's a powerful tool to use. We've had some care facilities in Alaska and here put on traditional music onto iPods or play it in the gathering room. And you see people who are quiet and reserved and kind of more advanced in their stages come alive and like remember things. The other area there's been the development of Zinnia TV, which is out of Seattle. And we've been partnering with them to develop an Indigenous TV channel. What they're noticing is just because you have dementia doesn't mean you don't watch TV, but regular TV is too fast. There's commercials. It's hard to follow a plot. And so I partnered with them this past year to develop Indigenous specific channels, whether it's landscapes or subsistence with native music in the background or whale hunting. So then you can sit with someone to watch TV and it's, at their pace. It brings up positive memories. It may have music that reminds them of home. That's one technology. There's been the development, of course, of the robotic pets that have been really big, whether it's a pet cat or a fake cat or a dog that brings the comfort to someone, brings people together to talk about, what's your cat's name? How long have you had it? We're seeing also technology companies trying to develop tablet programs that bring elders and youth together, whether it's a game or watching videos together. So yeah, I think there's a lot of room for growth in technology. It'll be exciting to see what happens in 10 to 15 years and what it'll do for people with dementia, but also bringing families together around that as well.
You had also brought up the issue of alcohol-related dementia in your presentation, and there was just a question that came in. Are there any suggestions on how we can develop resources for awareness campaigns around that?
I haven't seen any, but I think it's because of the I wouldn't say it's a stigma, but the conversations around alcohol use disorders and native populations we work with, it's really either it's not a good thing at all, or you're there to tell them they're doing a bad thing, or you're struggling and it's a health disparity. I think we need to be more proactive in thinking about it from a preventive measure, like long-lasting drinking behavior that's unhealthy could lead to, irreversible brain damage or cognitive impairment. I haven't seen any educational materials or flyers or posters on that topic. I think it would be a worthy research study to see if we could get younger people who may be more open to having conversations around alcohol. I know in our work around healthy aging, alcohol, we've been told by tribal councils that our elders don't struggle with alcohol, so we can't ask those questions, even though we know that some do. So I will look. It'd be interesting to see, but hopefully in a few years, younger people will help us develop those who are willing to have those conversations.
Are you aware of any of those kind of campaigns, Sarah?
I'm not aware. I haven't heard of anything around alcohol.
Okay. There's a question about end-of-life care decisions pertaining to caring for a person with dementia. How is that seen, understood, and made within an Indigenous cultural context? Are there any discussions related to options preferred? Are there any power of attorneys put in place ahead of time that you're aware of, or just sort of this question about end of life within an Indigenous context? If either of you could comment on that.
So from my perspective, that's an area of work that hasn't gotten a lot of traction in the communities we work in. I know that the care manual we've developed, the Denali Center in Fairbanks, those are questions that are brought up and addressed the first week you're brought in, regardless if you're healthy or not, or whatever stage of a disease you're in, or you're there for rehab. So those are to avoid those uncomfortable situations when your loved one has passed on or they're near passing on and you don't have those cultural protocols in terms of, do you call the family first? Do you call the priest first? Like, what are the cultural appropriate steps to take in preparation for passing on? There's a new program in Alaska around death doulas that are trying to bring back and have conversations around what does a good death look like. And so that was at the request of the communities, but otherwise I haven't heard much in terms of an Indigenous context around end of life and dementia, but hopefully people have these conversations more.
Did you want to comment on that, Sarah?
I don't really have an answer for end of life care right now.
Okay, thank you. Dr. Mark Matson and others have done some important research about intermittent fasting and the prevention of dementia and Alzheimer's. Are fasting protocols being considered as a prevention measure for dementia? And there is a sort of the same questioner sort of wanted to know what can we be doing to prevent dementia and Alzheimer's in our own lives?
So I'm not aware of any fasting programs or protocols to prevent dementia. I'm sure there's some out there, I just haven't looked. So that would be that. And then response to the second part of the question, I think the biggest thing we can do is walk, get fresh air, be out on the land, walk 10, 15 minutes, half hour a day. Depending on which research you read, physical activity, good diet, eat until you're 80% full, don't eat until you're full. There's been some interest around the blue zones, books that have come out over the past few years, whether or not those are related or could be overlapped with Indigenous practices. Eat your subsistence foods, be physically active as much as you're able. Brain games, keep your brain mentally active, don't abuse substances. Those are kind of what I think are important. Be social, don't isolate. The research is showing now that isolation is the new smoking. And so getting out, don't be sedentary. And even if you have chronic illnesses, we've worked with people who have been bedbound and are still healthy because they have these other elements that are so important.
I would agree with everything he just said. The diet is more of a thing for me. Just, watch what you eat, take care of your body, be healthy. Brain food.
So we have one last question, but we have had several comments coming in about thanking you both for taking on some of these really tough questions and answering them so well, and also how enlightened people feel through the work that you're doing and what you've shared today. They're really grateful for the information. So the last question that I'll ask before I switch over to our final slides, which show some resources, have elders played a significant role in research?
I would say yes. Every research project I have an elder advisory committee. I have elder mentors that guide me professionally in the work I do. I think we're starting to see more researchers with the community-based participatory research being such a huge or important part of the work we do with Indigenous populations, whether it's a community advisory board or elder advisory board. We have elder mentors that run our research center, help us guide us in the right way. So I would say yes. I might be biased, but definitely.
I agree. I have in our surveys that we were doing, we did have a lot of elders participating in that, such as, their community leaders and a lot of elders in our research.
So just another follow-up. Do you believe that this intergenerational sort of programming specific to Alzheimer's is helpful for those living with the disease? And that'll be my last question, I promise.
I would say definitely. I think intergenerational programming is important for everybody, regardless of the disease you have. I haven't seen any specific intergenerational programming for dementia. I do know there's care facilities in Alaska that have preschools in the care facility, so people can, or the elders or the residents can visit and play with them all day. I know that there's other care facilities in Southwest United States that are doing some great work around that area as well. I would imagine there's some care facilities in Indigenous communities doing that work around intergenerational that has a dementia component, but I don't know of any specifically for dementia.
Sarah, last comment to you.
I'm not sure about that question.
Okay. So the amount of discussion that has come out of your presentations to me speaks to the volume of the interest in this topic and the need for more discussion and research and information and programming that is specific to Indigenous peoples on Alzheimer's and dementia-related illnesses. So I really want to thank you both for the work that you're doing on the ground to help advance this really important and emerging area that we're going to be needing more data and more research, more programs, more resources for our communities. So I just really want to thank you both for your presentations and for your really thoughtful discussion. I'm just going to share my screen again and provide some resources that people can be accessing in addition to what's been shared in the chat box. So I'm going to do that now. So here is a listing of resources that people can be accessing. Again, you can take a look at the webinar slides after the webinar has been posted onto the NCCIH website. So don't feel that you have to write these down frantically. They will be available on our website. And as well, if you do want to join our mailing list, please do so at this using the QR code or the website here. So thank you again for this amazing presentation and wishing you both the best on the work that you're doing. Thank you very much. And thank you everybody for attending today's webinar.
Thank you.
Thank you.